How do genetics complicate pancreatitis diagnosis? Imagine trying to solve a mystery where the clues look like but come from different sources. That's what doctors face when diagnosing pancreatitis influenced by genetics. Pancreatitis can happen suddenly or come back repeatedly, and genetics add layers of complexity to understanding why. Several genes are involved, including PRSS1, SPINK1, CFTR, and CTRC. Mutations in these genes can cause hereditary pancreatitis or increase risk, but their effects vary widely. Some people with these mutations develop severe pancreatitis, while others never show symptoms. This makes it tricky to tell if the disease is truly genetic or caused by other factors. One challenge is that mutations in different genes can produce similar symptoms. For example, mutations in PRSS1 often lead to hereditary pancreatitis that runs in families, but mutations in SPINK1 or CFTR might just increase risk without directly causing the disease. Because symptoms like abdominal pain, nausea, and digestive problems are common in many types of pancreatitis, doctors often initially diagnose cases as idiopathic, meaning of unknown cause, before genetic testing. Another complication is that not everyone with a genetic mutation will develop pancreatitis. This is called variable penetrance. For instance, about 20% of people with a PRSS1 mutation may never have symptoms. So, finding a mutation doesn't always mean the person will get pancreatitis, and not finding one doesn't rule out genetic factors. This variability makes diagnosis more uncertain. Technical challenges also play a role. Modern genetic testing uses next-generation sequencing, which can sometimes produce false positives because of the high similarity among gene family members like PRSS1 and PRSS2. Misinterpreting these results can lead to incorrect diagnoses. That's why careful testing and clinical correlation are essential. Pancreatitis often results from a mix of genetic predisposition and environmental factors like alcohol consumption or smoking. This makes it even harder to pinpoint genetics as the sole cause. Doctors need to look at family history, lifestyle, and genetic test results together to get the full picture. Genetics can also influence how early and how quickly pancreatitis develops. Children with certain mutations may experience symptoms earlier and progress faster to chronic pancreatitis, which can lead to complications like diabetes or pancreatic cancer. Recognizing hereditary forms early helps in planning proper management and surveillance. Certain genetic mutations linked to hereditary pancreatitis also raise the risk of pancreatic cancer. This connection underscores the importance of accurate diagnosis so that appropriate monitoring can be done to catch any serious issues early. In summary, genetics make diagnosing pancreatitis more complex because they add variability in symptoms, requiring advanced testing that can be prone to errors and interact with environmental factors. A thorough approach involves family history, genetic counseling, careful testing, and clinical judgment. Understanding these complexities helps ensure patients receive the right diagnosis, management, and surveillance. Always consult healthcare professionals for personalized advice, as each case is unique and requires careful evaluation based on individual circumstances.